We have a school-based health center here in Truman High School. We have a school-based, school-linked health center in Taylor. We also will be opening one up in Romulus High School, one in River Rouge High School. We currently have a school-based health center in the Westwood School District as well as the Wayne Westland School District. Access to care is our #1 priority with the students and the patients that we serve. There are a lot of barriers that are in place for these students, transportation being one of them, as well as follow-through. A lot of them don't have a primary care physician to meet those basic needs.
Part of it sometimes is a financial issue. We have kids who are underinsured or uninsured, right? And we're working really hard to make sure that they're insured, but there is still certainly a population of them that aren't, or that don't have coverage for their mental health services. So they may have medical insurance, but it doesn't cover any kind of counseling services. Salina is now an 11th grader, and she first started coming down as a 9th grader, and she just was really having some self-esteem issues. She was having some relationship conflict. Mom was really worried about some of the decisions that she was making and how sad she was. Salina's an adorable girl, but when she first started coming to us, she would cover her mouth with her hand. She was really self-conscious about laughing, anything that showed her teeth.
I was telling Mom that I didn't like the way they looked. I didn't like smiling. It was all crowded. I was made fun of a lot through middle school, so walking through high school made it worse.
As she was little, they wanted me to get spacers, but me and her father had split up, so there wasn't a lot of income for it. So I want to say about 3 years ago, she was just upset with her mouth. She was not happy. All she wanted was braces, and I couldn't do it.
We knew about the SMILE program. I've actually referred other students who have gotten braces through the SMILE program. And one of the things that I knew was happening with Salina's family is that they just didn't have the financial means necessary to be able to get any kind of orthodontics, any kind of braces. A lot of times people don't access resources because they just don't know that they exist and they don't know how to access them.
When me and Rhonda were talking about the SMILE program, I kind of got happy. I was excited. I was hoping that I'd get accepted, be able to get braces.
She came in and talked to Rhonda and came home all excited that Rhonda was maybe be able to help with through Oakwood, and we went from there.
Coming back to school with the braces, I was like really happy and excited. I smiled, even though my teeth weren't straight yet, but I smiled.
A lot of students don't have really great coping skills. It's another reason that they aren't in school a whole lot. You've got a lot of social anxiety, depression, things that really affect them being able to be successful at school. One of the things that I think is really helpful is that we're on site, we're at school. Parents don't have to take off work to drive their kids to the doctors or to come in for a counseling appointment. We can really allow them to access a lot of different services, connect them to a lot of different services right here in the building, and the parents don't have to do a whole lot.
Oakwood has been very successful with these adolescent health programs. We see our results of our increase in immunization rates. We're seeing a decrease in the amount of pregnancies, as well as our kids, our adolescents following through with increased coping skills. So through all of our programs and our evidence-based programs, we have identified outcomes that really demonstrates the value of our services.
I've had my braces for 4 or 5 months.
So what's your favorite color now?
I like royal blue.
Is that the school color here?
Yeah.